This is ADRP Research Roundup, distilled research for you to consume in less than 5 minutes. In light of COVID-19, we asked, what research insights are there from the Great Recession? First, who was our audience? ADRP membership is 63% higher education, 15% in healthcare, and 17% split among other nonprofits such as social services, environment, and the arts. As of 2015, higher ed represents less than 1% of total charities, but brings in 11.7% of total charitable revenue. If you think that's high, let's look at healthcare. Hospitals alone represent about 2% of total charities, but bring in almost half of total charitable revenue. So economic trends in these sectors impact our work and fundraising overall as a field. As for the Great Recession, the nonprofit sector did see revenue and asset growth of 15%, but it impacted subsectors differently. According to a 2011 study, healthcare revenue increased by 6%, but higher ed revenue decreased by 15%. Why did healthcare fare better during the Great Recession? We got curious and looked into the data. After the Great Recession, wages, income, and employment rates were slow to recover for certain demographic groups, widening the wealth gap. Declines in net worth were most pronounced at the bottom of the tax bracket distribution. While households in the top 5% had roughly the same net worth in 2003 to 2011, households at the median retained 55% of their net worth, while those at the bottom 25th percentile retained 15%. So while overall the dollar amount to charity has been increasing, the number of donating households is on the decline. What does this mean for our work? It may depend on your subsector and which tax bracket you most rely on for gifts. It's interesting that there's a correlation between healthcare revenue increasing during the Great Recession, while almost half of hospital revenue came from the top 25% tax bracket, the same tax bracket that did not see a decline in net worth from 2003 to 2011. It is encouraging to see that healthcare fundraising performed well in the last economic crisis. Charitable revenue growth may be especially important now due to revenue loss from non-essential clinic closures. What does the research tell us about survival strategies that worked well in 2008? Here are 5 takeaways. Continue fundraising efforts and build lifelong philanthropic relationships. From 2006 to 2015, the Dana-Farber Cancer Institute more than doubled donor relations staff, and they increased their repeat donors by 14%. One paper showed that increasing donor loyalty by 10% would increase the lifetime value of the fundraising database by up to 200%. Convey optimism. The Lilly School of Philanthropy concludes that an individual's generosity is affected by feelings of optimism about the future. They need faith that a donation will somehow make things work better for them or for those around them. A Blackbaud 2011 study showed success through increased use of online, social media, and mobile technology, which may have been cutting edge at the time. Which makes me wonder, what is new technology today that we're not making full use of? Strategic thinking and planning. Undergo program evaluations to determine whether resources are channeled most effectively. How can you streamline and innovate to lower administrative costs? During the Great Recession, professionals found success through communicating and forming collaborative relationships with similar nonprofit organizations. It increases synergy that can lead to new creative approaches and economies of scale. Keep close watch on your environment and adopt best practices. From all of us in the ADRP Research Committee, thank you for watching and good luck as you continue to find new ways to add value to your organization's fundraising success.